necessarily those of CNS Channel 6.
Hello again, Guyana, and welcome to another edition of Facing the Nation. I am Malika Ramsey. Thank you so very much for joining us and, of course, inviting us into your homes again. Last week, we indeed had a full program for you, as always, and I did promise you, I gave you a lineup of what's to come. We did talk about focusing on the health sector today. That has not changed. We're still focusing on the health sector. However, I did promise you Minister Lawrence, because she was here a few months ago and she talked about politics the last time. She promised to come back and talk about health this time. But what came from the minister, the good idea is always to have people who are working in certain specific key areas every day who can, talk to you. Not that the minister is not knowledgeable about what is happening, but it's always better to get it. It's easier directly from people who deal with certain issues that we want to focus on every day. And also, this is coming off of the Health Expo that was recently held at the Sophia exhibition site. We were also talking about that a few weeks ago. That was successful, and one of the things that came out of that, in Guyana, we're talking everything green initiative, green state development strategy, and of course that is for the benefit of our country. So what the main focus of our conversation today, or I should say the initial focus, is going to be about a green hospital. And I'm very excited about this because, again, we're hearing green this, green that, but when Minister Lawrence raised it with me earlier in the week was the first time I heard about, the actual, an actual green hospital. So that is just to give you an idea of what today's conversation is all about. We're still staying in the health sector, but we're going to be not focusing on the minister of herself, but what is actually happening, and with some specific focus in Region 5. So it is my pleasure to welcome to the first time on Facing the Nation. Hopefully he will enjoy this conversation so much he will return after today. So it's my pleasure to welcome Dr. Desmond Nicholson. He is the RHO Regional Health Officer for Region 5. Welcome to Facing the Nation.
Thank you.
All right, welcome. And yes, it is great to have you. Very wonderful to have you. And that's the first thing you have there, the green hospitals. Even before you talk about the initiative for Region 5, the simplest thing to start with, what is a green hospital?
Well, Malika, a green hospital is, it is no different in its exterior from, let's say, any other hospital that there is. But we know that hospitals are places where people convalesce from prolonged periods of illnesses. There are places that take care of the patient's well-being. And certainly the central theme behind the hospital is to ensure that the curative process is a complete one. So a green hospital, essentially, what it is it is a space where a patient can come. They can be treated for their ailment. The curative process is facilitated, but all of this is done in a manner that utilizes natural resources in a very sustainable way. That essentially is what a green hospital is.
All right.
Of course, there are.
I know there are going to be a lot of ins and outs. we're talking about natural resources, yes, and we know we can get energy, and I'm not sure, correct my ignorance here, if that is what it is in terms of electricity and so on, because
Yes, we are talking about water, we are talking about electrical energy.
all right,
Yes.
so we don't have to worry if persons, God forbid, are so ill to the fact where you have to be on like life support machines and so on. All of that can be facilitated.
Can be facilitated in a green hospital, yes.
All right, let's talk about, and viewers, remember, even though, yes, this is Guyana, and we're talking about the health sector in Guyana, Dr. Nicholson, just to remind you, he is the RHO for Region 5. So at this time, he can more speak of what is happening in Region 5. Why do you feel there's a need to have a green hospital in Region 5 at this time?
Well, I think looking at the bed-to-patient ratio, according to the WHO statistics, World Bank data 2015, Guyana's bed to 1,000 population ratio is 1 to 5. The WHO is actually recommending 5 beds to 1,000 patients.
Okay.
Additionally, your viewers may know that we have 2 hospitals in Region 5, the Maikoni Cottage Hospital and the Fort Wellington Hospital. In total, they probably provide about 50 beds for inpatient specialist services. Now, if we do the math, that is way below what is the recommended standard. Additionally, since becoming RHO, what I've found is that there's lots of issues with space, and the space constraint has really preventing us from being able to have all our services concentrated in one place.
Okay.
Additionally, you find that we have the need to refer patients to the New Amsterdam Hospital as well as to the Georgetown Public Hospital for specialist care, for specialized care. And so what we were thinking as the Department of Public Health in Region 5 is that we wanted to provide a facility for those 52,000 residents or so in Region 5 where they can go and they can have all of their health needs taken care of. We're talking about a general hospital that offers all of the services that you would expect to be offered in a general hospital. An emergency department, surgical department, internal medicine, obstetrics and gynecology. I will speak about that
A little later on.
a little later on. But that is the idea. And in so doing, we believe that if we're able to cater to the health needs of our population with this kind of institution, I think we'll be able to, in essence, we'll be allowing the Georgetown Hospital to do a bit more in terms of perhaps assisting with cross-boundary flows from other regions other than Region
5.
Other than Region 5.
So once this kind of hospital, or let me just move away from the word hospital, once this type of medical facility is in place, you wouldn't need to, sorry to say forward, because we are talking about human beings, but for want of a better word that I can't find right now, but it's a case where you wouldn't have to forward patients from Region 5 to Region 4, is it?
Well, certainly that's the idea.
That's the idea.
That's the idea. We're talking about a 350-bed hospital with all of the specialties that one would come to expect in a general hospital.
Okay.
Now, having said that, I should point out that we do recognize that there is the Fort Wellington Hospital, which offers medical services in a general sense. Obstetrics, internal medicine, emergency, those sorts of services are offered at the Fort Wellington Hospital. The Maikoni Hospital is a work in progress. You may know that renovative works were started, I believe, in 2015. to the wards, internal medicine, pediatric, maternity wards. We are almost complete with that. But the vision is, because we have the space constraint, we're not able to provide the kind of services to each resident in a timely fashion, I would say,
Okay.
and probably with the kind of appropriateness that is necessary, because we have to be referring people.
Yes.
We think that it is perhaps a useful thing to advocate for a new hospital, so about 350 beds. If you do the math based on the World Bank data, even with that facility, Guyana as a country, we would not meet
The full requirement.
the full requirement as stipulated by WHO.
But at least it would be a great, not great, but a significant improvement.
Yes, certainly. But what we envisage is that Myconi, for example, so we don't want to do away with these hospitals. We're proposing that they offer some sort of specialized care. Myconi, for example, we're proposing that we make it into a maternity home where we can focus on safe motherhood, neonatology care. And this, of course, is going to assist greatly with the GPHC. As you know, the GPHC is always crowded in the maternity wards.
Yes, and we always like to beat up on them. Yes.
So we believe that Myconi can be made into such an institution. More so because Myconi, we're also working on the theaters in Myconi, surgical theaters at Myconi.
Right. Okay. So it's not a case where you just leave them. You're looking to this.
No.
Understood.
We're looking to if we're going to make Myconi into a maternity ward. Essentially, what we want to do, or why we're doing this, is because there are theaters there. We can perform cesarean sections there. And then even within the institution of itself, we can provide some subspecialty care. For example, it is common that we have the antenatal wards or the prenatal wards and the maternity ward, or the antenatal department, and then there's the labor and birthing room, and then there's the postnatal department. But there are also, in other parts of the world, we have seen that it is possible to look at the pregnant female in terms of conditions, for example, hypertension. We can have wards dedicated for hypertension in pregnancy, diabetes in pregnancy, sicklers as well. We can look at those things. So what we are saying is that we're not going to do away with Myconi and Fort Wellington, but rather we're going to make them into specialist institutions that can really make a great contribution towards achieving the goals that we as a nation have set out.
In terms of health. I understand that. I want to, and we were discussing some of this, viewers, before we came on air, and we talked about the best practices, countries that would have gone specifically with the green hospitals before and probably have been successful. But before we even talk about that, in Guyana we have this way, because people are the people who are at home, and the people who would subsequently watch this via YouTube would get excited hearing you talk about this. My question now is, how realistic in terms of how soon the new and the green hospital is? What can we expect? How far have preparations gone? Has it gone past just a proposal or just ideas?
Well, we have made a proposal as a Department of Public Health and as a regional democratic council, Region 5, at the level of the Ministry of Public Health.
Okay.
And I think the minister is is, I don't want to say impressed, but I think she likes the idea.
Okay.
Because it, first of all, it ties in with the national agenda of going green,
Yes. It does.
protecting the environment,
Yes.
mitigating mitigating climate change and all of the effects of climate change as it relates to health. So at the level of the central ministry, we have spoken about this. We have approached via written correspondence the MMA for land to construct this hospital.
Okay.
We're waiting a positive, we hope.
Hope
that
to get a positive, yes.
we hope that they will give us a positive response. Essentially, we're looking for 40 to 50 acres of land. But this sort of institution can be constructed, if it is a matter of space, on 25 acres of land.
Wow,
50 acres,
far
40,
difference.
50 acres, we're thinking about expansion. We're thinking about green
Eventually,
spaces because the research has shown that green spaces, gardens, landscapes, those sorts of things help to reduce the recovery time of patients and so on. So we're thinking, we're trying to be as futuristic as possible. At the same time, we recognize that the health sector plays a major role in terms of the carbon footprint of commercial enterprises agencies. If I'm to give you some statistics, the NHS, the National Health Service in the United Kingdom, produces about 18 million tons of carbon dioxide annually. And you will know that carbon dioxide is a greenhouse gas. And we, as inhabitants of the planet, have not been doing a very good job because we've been using lots of fossil fuels to cater to our energy needs, and we've been engaged in lots of deforestation. All of those activities, even cement production, as we talk about industrialization.
And that's big business in Guyana at this point.
Building cities. Those activities, all of them increase the levels of carbon dioxide in the atmosphere as a greenhouse gas. And you know about global warming and climate change, and there are health effects.
We always talk about the MDGs. Yes, we're on to the MDGs, Millennium Development Goals. In terms of health, the goals in health, is this initiative will any way contribute to us attaining any one of those goals?
Well, yes.
Okay.
I think this proposal boldly embraces the Declaration of Alma-Ata 1978, which speaks about health being a fundamental human right and health for all. You'll appreciate that through subsequent meetings and conferences, health professionals and stakeholders will decide on which targets we're to meet based on the indicators and what the indicators from different countries inform them as to how they should act. But in terms of providing healthcare for the people, providing healthcare in an equitable manner, we believe that in doing so we are saying yes, we embrace the notion that health is the right of all human beings. We are saying that we embrace the notion that there is no reason why we should allow differences, be it cultural, economic differences, sociocultural, whatever those differences are, to prevent the people of Region 5 specifically from attaining the highest possible health status
Okay,
that they can
great.
achieve.
Finally, and I'm happy that you raised the highest possible health status, because I want to talk about some other health matters in the region. But finally, before we come off of the green hospitals, again, as I did mention before, we were talking about, because most times, again, viewers, sometimes we don't like to hear it because we think we're all good and perfect, but we are still a developing country, we're part of the developing world. So obviously that means it's good to take ideas from the developed world. In terms of this green hospital, my concern was, are we going to use best practices of other countries? And I think earlier you mentioned India.
Yes, well, you see, the Green Initiative is, we are taking best practices from around the world. However, we must be cognizant of the fact that practices are good, but perhaps the applicability should be tailored to the circumstance. So we recognize Region 5, when I say we are Department of Public Health,
Region 5, yes.
we recognize that hospitals, that the healthcare sector, for example, it does not operate in a bubble on its own. It is part of the environment. It is part of the movement, or I shouldn't say movement. It is part of the drive to use resources. In this case, I'm alluding to fossil fuels to generate energy. We're not exempt from that. We're all, whether it is the health sector, whether it is strictly industrial, we're all using fossil fuels, and we're all engaged. Yes, we're all engaged in doing a bit of harm to the environment.
Yeah.
So we recognize that, but we also recognize that it is necessary to use data from other countries, developed countries, but at the same time we want to tailor that to what obtains here in Guyana. So there are some things that we're advocating, yes, and there are other things that we'll say, contextually, it probably would not be work here in Guyana. So,
all right, great. Viewers, if you're now tuning in, today my conversation is with the RHO for Region 5, Dr. Desmond Nicholson, and we're talking health sector. We started off talking about the Green Hospital, but it's interesting to hear from him what is happening in the region generally in terms of health. He talked about the facilities that are there currently, so we're going to chat some more about what's happening in Region 5 in terms of health. Earlier you mentioned, Dr. Nicholson, you mentioned obstetrics and gynecology, and I'm assuming that you wanted to do some specific focus on that. But before we get there, one of the problems we continue to hear about in Guyana in terms of the health problems that that are really prevalent, and we've been hearing this for years, chronic non-communicable diseases. Is that problem also happening specifically in Region 5, or are there other health issues that people are battling that you find that your department, and of course by extension the Ministry of Public Health, will be able to address stoon?
Yes, well, we are not operating in a bubble in Region 5. We're just a stone's throw away from 4, and it's. Yes, we do have annually. We have seen from 2017 to 2019 about 16,000 cases of chronic diseases, non-communicable diseases. We have treated both at Fort and Myconi. So we're not any different from any of the other regions.
The other regions, okay.
And this is a problem that that obtains, the world over. we did a very good job in terms of treating infectious diseases, and I think maybe we stopped paying attention to non-communicable diseases and some of the causes and the risk factors and so on. So we are actively engaged in ensuring that the population is sufficiently educated on what are the risk factors, the medication management in terms of adherence to medications, the need to practice regularly physical exercise. I mean, dietary measures as well. So we are actively engaged in our clinics at the hospitals as well as in the health centers.
Do you
in
find,
tackling.
I'm really sorry to cut it on you here, but do you find that the people are responding well in terms of wanting to eat better, wanting to exercise? Because really and truly, there's only so much you as a department can do. You can't take the full responsibility. If I recommend that you do this and you don't, we can't then blame the department. So do you find that you're getting the assistance from people to say, okay, look, I want to eat better, I want to live longer, I want to exercise? Is that happening, or we still have a far ways to go?
I think it's happening.
Okay.
We have some ways to go, but it's happening. I think Guyanese were becoming more health conscious. I think in Region 5, from the statistics that I've seen, for the last 3 years, there has been, I don't want to say there's been a gradual decrease, but I think 2018 to 2017, 2018, we did see a bit of improvement. And we're hoping that come 2019, the end of 2019, we'll see even better numbers. I know the doctors are actively advocating best practices, advocating exercise, dietary measures. We are doing promotions as it relates to chronic illnesses, and I'm hoping that come the end of 2019, 2020, we will see a very significant reduction based on our promotion activities that we have been engaged in Region 5 as relates to non-communicable diseases.
Are more health fairs and it doesn't necessarily have to be as big as a fair, but are these sort of activities a part of your plan?
Well, yes. We have, since I've been regional health officer, we have been actively engaged, and I know the doctors before me, they have been actively engaged in promotion activities like the likes of what you mentioned, health fairs. We have invited NGOs to come in and to collaborate with us. So yes, we are working along those lines to definitely try to reduce the numbers, the incidences of NCDs.
Yes. All right. And I'm going to come back to what you mentioned earlier, and I got the feeling that you wanted to say something specific about it, the obstetrics and gynecology.
Oh yes, yes. No, I wanted to say it. I started to speak about it earlier. That if we're able to get the Green Hospital off the ground, Myconi becomes a maternity home, a maternity hospital. And essentially, we're going to be able now to focus on this issue of safe motherhood, on this issue of neonatology care, and we're really going to be able to offer services that are more specialized within the context of maternity care. So yes, that is the idea, and of course we will be helping a lot with the GPHC with their numbers, because we know that they're often overcrowded.
I'm
Yes.
really happy you talked about the maternity. Again, I know you can't speak for everywhere in Guyana because of where you're
Mm-hmm.
stationed and what you do, not because of general ignorance or anything like that. One
Mm-hmm.
of the problems we keep having in Guyana, every time it happens, one or two, whether it be a mother and a child
Mm-hmm.
die or the other way around,
Mm-hmm.
there is a big outcry. And I'm asking for your opinion here as a medical personnel. What is the problem? What are we not getting right? Why is that? You think you call it the mortality rate? Why is it so high? Why do we have such a big problem here?
Well, I wouldn't say that there have not been improvements in recent years.
Okay.
There have been improvements.
Mm-hmm.
I think the program in obstetrics and gynecology being offered at the GPHC is testament to that fact that we're training more people.
All right.
I think the Ministry of Public Health, I saw recently that there were donations, and I might be mistaken with this number, but to the tune of $80 million in terms of medical equipment to the maternity wards at the GPHC. So I believe it's a question of personnel, which we're addressing currently. It's a question of the availability of the right types of equipment and devices and so on. And I think based on what I've seen recently, we are addressing those concerns. Of course, there are instances where perhaps communication isn't always optimal between the client and the doctor, the client and the medical staff, or at least so it would seem from the media. But I believe that we are headed in the right direction. I believe, we're training people. We are equipping our centers with the necessary devices and equipment and medications that are needed to ensure that there is safe motherhood. So I think we're headed in the right direction.
Okay.
Yeah.
Viewers, in case you're confused, because I know sometimes I tend to ramble, especially when I get excited about a topic. What I was asking Dr. Nicholson about a few moments ago would have been about the high rate of maternity deaths. I'm not sure that's the term I use, but I tend to ramble at times. Finally, before I begin to wrap up my conversation with you, and a very interesting conversation it would have been so far. Recently, I was a bit taken aback and exposed to, again, I'm not sure if I'm getting the medical term right here, but it's basically children who are born, we call them special needs children. I think the correct term is micropulsy. It's a disease that they're born with where the brain is smaller than usual. And I was talking to a friend of mine. I only discovered recently that a colleague of mine, that she has a special needs child. And one of the things that they were talking about on the feature that I saw is the fact that some of these babies, they were born through mothers who apparently at that time would have either contracted chikungunya or Zika. My question to you, doctor, especially for Region 5, are measures in place to ensure that should we have some sort of resurfacing of those? Because you don't hear about Zika and chikungunya now. You haven't heard about that during this year or late last year. It seems as though it was just a season. Are measures in place to ensure, because it's so sad when babies are born that way, they have to live their entire lives like that. Are there measures in place to ensure that pregnant women in that region are protected in the event that there is a resurfacing of these sort of diseases that are carried by mosquitoes?
Well, we were recently engaged in a fogging exercise. We started in April, and I think we're just about to conclude that exercise. And there have been trouble areas that we know that we need to revisit. We pay attention to the information coming out of the Ministry of Health. We also do our own surveillance at the regional level. once the information comes out of the Ministry of Health that yes, there is a threat of chikungunya, a threat of Zika, a threat of babies with microcephaly from these types of illnesses, we are then able to take action in-house within the region to ensure that the population is sufficiently educated on measures to avoid being bitten by these mosquitoes. And we are also taking the initiative in collaboration with the Department of Vector Control to ensure that focking exercises are done. The region continues to budget monies for such activities. In fact, for 2020, we are proposing some increases because we are going to take on the mantle. We're going to take on the I don't want to say the burden, but we're going to take the responsibility of establishing our own vector control unit within Region 5.
Okay.
That isn't necessarily an idea of the region. This is something that we were
more or less examining.
More or less, the Department of Vector Control indicated that because for a couple of reasons. I gather one, it is financial, and the other one is that it is necessary that we assume the mantle. It's necessary that we take control of the measures that are necessary to create the kind of abatement that is necessary to combat these diseases that are mosquito-borne. So on that front, Region 5 will be moving in that direction. However, I mean, if the child is here, we should be in a position to provide some kind of care. One of the things I neglected to mention about the Fort Wellington Hospital is that we are thinking about palliative care and rehabilitation for Fort Wellington. Once we're able to get our green hospital on board, which will see us save a lot of money in terms of the use of electrical energy, water conservation, the elimination of things like sick building syndrome. Sick building syndrome.
Care to explain a bit?
It is a phenomenon where persons might complain that they're generally unwell when they come to a building or they come to the hospital and they stay for a prolonged period of time. They feel unwell.
Okay.
And the symptoms are very non-specific. They talk about dizziness.
Okay.
All right.
It's as if you're looking for something.
But you're not looking. It is a phenomenon, and it has been studied to some extent, and it has been linked to toxins in the air, such as
So
volatile organic compounds, etc. But the researchers are thinking that it is perhaps the risk factor is that the person is in the building for prolonged periods of time. All right, and again we come back to the issue of a clean and green hospital in terms of the construction materials and so on that we use, in terms of the kind of paints that we use, the kind of furniture that we use, the carpeting, all of these things can emit these volatile organic compounds, as they call them. A bit of science. They have very low boiling points, and so they evaporate easily, and they go through the process of sublimation very easily, and then they're in the air, and the patients and the staff, they take them in, and they complain of dizziness and headaches and fatigue, and there's always something that you can't quite put a finger on it, but it's there. And then when they leave for a period of time, they feel better. that was perhaps going off a bit from
I
what
was
you
just
asked me.
about to say, I think I just got a reminder of my integrated science class and then a crash course in something else that I haven't done before. So, yes.
Yeah,
Yes.
but yeah, essentially, what we want to do in terms of our rehabilitative services is we want to cater to people who are autistic, people who have got neurological problems. You know, so the idea is that once Fort Wellington is afforded the kind of services that we envisage that we wanted to have. If there is a recurrence of that sort of thing, in terms of rehabilitation, I'm sure that we will be able, in some way, to provide some kind of support to the mothers and the families of those children, and you know, aid in their development as much as we can.
Okay, all right, great. Of course, this is where we have to bring the curtains down on our conversation, but I'd like to give you an opportunity. Again, you are the Regional Health Officer for Region 5. I'm not sure if I've missed anything that you would want the public to know about your department at this point in time, so I'll give you an opportunity to say anything else that you may not have said.
No, just that we're working hard for the
That
people
you
of Region
continue to
5.
work hard, yes.
Work hard to guarantee the basket of services offered by the Ministry of Public Health to the region to the residents of Region 5.
All right, great. Thank you very much. Of course, viewers, if you're
Thank
now
you.
joining, this would have been a discussion with Dr. Desmond Nicholson of Region 5. He is the Regional Health Officer. And if you're now joining and you've missed it, subsequently, this conversation will be both on my YouTube channel and Facebook pages. Again, Dr. Nicholson, thank you so very much for coming on Facing the
Thank you
Nation.
for having me.
All right, we'll take a quick break. On the other side of the break again, it's going to be a brief one today. We'll deal with some housekeeping matters and then begin to wrap up. Stay tuned. This is Facing the Nation.
That was it?
Yes, that
Oh.
was. All right, viewers, thanks for staying with Facing the Nation. Of course, we're going to have a short one for you this week. I did promise you last week that we would have dealt with health and tried to deal with housing, but I'm made to understand that the minister responsible for housing is otherwise tied up at this time. I trust that she can find some time to be with us eventually soon. We had a very busy week in Guyana so far, a week that we should be really, really proud of. I know I was excited because we had the visit. We appreciated his visit. That is the visit of the president of Ghana. He was here earlier in the week. We appreciated the visit, but what I enjoyed most of it is the statesmanship that I saw. You know, I always urge Guyanese to behave themselves, and Guyanese were well behaved. I was so excited and at the same time proud of our defense force, and they looked really, really great, really uniformed and respectable, and a team, a defense force that we can be proud of. And I even got so excited about it. Those of you who follow me on social media, the evening of the president of Ghana, well, it wasn't evening, I think it was about 2 o'clock in the morning. At the time of his arrival, our soldiers were on the tarmac at the CBJ airport, and they were awaiting his arrival, and they looked so uniform. And again, it's something to be so proud of. And I even boasted to a friend who lives in Barbados, and earlier she shared the video of, because I think he is currently, earlier today, the president of Ghana. He went on to Barbados eventually, and they also have their military. So clearly it's protocol in various countries. They also had their military on the tarmac at their airport waiting for him, and I was so boastful about the fact that I can send you our photograph, and our military people look better than yours. And yeah, my friends in other countries know that I can be very competitive, especially when it comes to me shouting how proud I am of Ghana. That is when we as Guyanese behave ourselves. So I thought it was really a proud moment and 2 proud days for Guyana. The cleanup efforts were amazing. I just trust that, and kudos to Mr. Narayan, Walter Narayan. He is the director of solid waste, the solid waste management department there at the Georgetown City Council. Kudos to him and his team, the mayor, the deputy mayor, all of them, the various councillors. They really worked hard to make our city, our country look really great, specifically our city, because of course that is the Georgetown City Council. And because of the fact that his visit was short, he was not able to go all across our country. But being right here in the capital it was something to see, and I'm really, really happy about the cleanup efforts. I wish it would continue, not only when we have visitors. I know some people are on social media and they were, sometimes regardless of what you do, there are some people out there who have lived their lives to be bitter, and it's as though they don't know to be any other way other than negative. And they were complaining, saying that why this can't happen for us only in Guyana here, we only do it for a visitor. Understand that certain things take progress. I agree with you to an extent that yes, we should try to keep our city clean at all times, but come on, you at home, if I call to say that I'm coming over, or any stranger calls to say that they're coming over, the first thing you're going to do is ensure that the floor is clean, the carpet is clean, the windows are clean. So we clean up for visitors, and really and truly nothing is wrong with that. Again, we all do it, but at the same time, we'd like to see a greater effort. And this, when I'm talking about this greater effort, I don't expect it to come from the Georgetown City Council alone. So those of you who like to eat, and still, imagine in 2019, people are still doing that. You eat and you just throw things willy-nilly out your window, your vehicle window, or you just drop it right there and you move on. You are also to be blamed. You're also responsible. You have to take pride in your own country, in your own city. If you don't keep it clean, no one else can come from any other part of the world to keep it clean for you. So again, that really is a good thing that happened for us. Earlier this week, I know bilateral agreements were signed and so on. I have not been able to fully read through some of the details of what we were expecting, but just know that our relationship with Ghana, of course, through the president's visit here, has been strengthened. I also, even though we beat up on him a lot for the things that he says, sometimes the unnecessary things that he says, because really and truly he's in this mode of opposition, and he thinks that he has to oppose every single thing just because he's the opposition leader. But I also admired the fact that the president of Ghana also met with the opposition leader. The opposition leader spoke about that during a press conference that he had, I think it was after, sometime yesterday or the day before that. Obviously, other parts of the press conference, he had to come down on our president's case and all that. But again, I think it's become the opposition leader's nature to complain. If he doesn't complain about something, he doesn't feel good. But I guess that's fine. I'm fine once he's not disrespecting his colleagues, whether on his side of the fence or the other side of the fence. And, and I notice he's also making an effort, which, we should congratulate him for that. He's also making an effort now, a special effort to say President Granger and not Granger. So we also congratulate him for that. But again, a lot of things happened in our country this week. I mean, today's Friday. A lot of things happened in our country this week that we should be very proud of. If we can only have several more weeks of this, we would be in a better place, and we would practice to be better people, so that even when, which is a fact, when people say we're a developing country, I mean, some people still call us third world country, but I don't think that is politically correct to say anymore. But even when people point out that we are part of the developing world, we must be part of the developing world with pride and with success and with great things. Unfortunately, that is all I have for you today. Next week we return again. I'm not sure if we're going to have the minister responsible for housing next week, but whatever we have, I promise you that it will be informative as usual. I want to say again, thank you very much to Dr. Desmond Nicholson, RHO for Region 5, for coming. And also thank you very much to Minister Walter Lawrence. On that note, I take this opportunity, I think her birthday was on Monday, I take this opportunity to say a very happy belated birthday to the Minister of Public Health, Walter Lawrence. We trust that you would have had a great one. And of course, we wish you nothing but God's richest blessings and guidance, especially in your portfolio as Minister of Public Health and also your portfolio as Chairman of the People's National Congress Reform. Wisdom and guidance are always needed in such positions, especially as a woman in such an environment. You know, women are still trying to, some are still trying to get their feet or their foot in the door, while others have gotten their feet or their foot in the door and are still trying to rise higher. So we congratulate any female who is working in such positions and also been doing a good job. I want to say thank you very much to her viewers so that you'll be clear. I did promise you last week that she would be here. She didn't cancel. It's just that, again, as the Minister of Public Health, she understands that there are various departments, various regions, and it's better to have people who are actually working in the regions or in specific areas of the health sector to come and talk about these things. Because yes, she's going to come here and she's going to talk about the improvements in the health sector, but she's only one person and she may not be able to give you specifics immediately about what's happening in every region. And I know one of the things that she is very excited about, and that is the reason she wanted Dr. Nicholson to come here today, is to talk about that green hospital. You heard it from the doctor too. We're on a path whereby we're trying to create of course it's His Excellency's vision, a green state. It will keep all of us healthier, more money for our country in whatever ways. And of course this is all happening at a time when we're still trying to get comfortable with what is still our newfound oil. So all of this is coming at a really great time. But I said all of that to say, you know, sometimes I can ramble on. I said all that to say that it's not a case where Minister Lawrence canceled. She just felt that another representative from the health sector, from her ministry, her department, should come here today and talk to us. And we got a good insight of what is happening in terms of the health sector in Region 5. So you see, we don't always deal with politics here. We try to go wider and give you information that will benefit us as a people and us as a country. So I'm going to leave it there on that note for this week. I always encourage you to be good Guyanese citizens. Take care of yourselves, take care of each other. I am Malika Ramsey, and of course, this has been Facing the Nation.